Multiple sclerosis. Multiple sclerosis is a chronic disease caused by a disorder of the immune system, accompanied by damage to the myelin sheath of nerve fibers, resulting in impaired conduction of impulses to the brain. The pathology debuts at a young age, and in the future can cause the development of severe complications, including disability. It is impossible to completely recover from multiple sclerosis, but timely seeking help, competent diagnosis and properly selected therapy increase the chances of stopping its progression and long-term remission. The first signs of the disease begin to appear between 20 and 40 years of age. As a rule, their severity decreases, but then intensifies again. The patient may complain of only one thing. Then months or even years may pass completely asymptomatically. In addition, sometimes the pathology manifests itself only once, without reminding itself in any way. Sometimes multiple sclerosis progresses extremely quickly, with the problem getting worse over weeks or months. Classification of the disease. The disease is classified according to forms, taking into account the nature of the course. 1. Relapsing remitting multiple sclerosis. Exacerbations do not occur often during the period of improvement. Brain functions are normalized, sometimes completely. 2. Primary progressive multiple sclerosis. It develops slowly, its severity increases gradually, and brain functions do not normalize. 3. Secondary progressive multiple sclerosis. It is characterized by rare exacerbations, the symptoms gradually progress. 4. Progressive remitting multiple sclerosis. Accompanied by rare exacerbations. Over time it becomes severe, depending on the intensity of the disease. The following stages are distinguished. Acute, takes up to 2 weeks from the onset of symptoms. Subacute, takes up to 2 months. Stabilization, exacerbations are not observed for several months or longer. Clinical picture. The clinical picture varies depending on where the main pathological focus is located. As new areas are involved in the process, the signs intensify and there are more of them. Damage to cranial nerves. When the optic nerve is damaged, diagnosed very often, which is involved in the process of perceiving a picture, the following symptoms are observed. One eye suddenly begins to see worse. There is a veil, spots, a feeling of sand in the eyes. The image is perceived as blurry, the outlines of objects are unclear. Blinking does not improve the situation. Loss of visual fields occurs. Temporary. Partial or complete color blindness is observed. Bothered by pain in the eyes, which increases when moving them. Symptoms do not go away for several weeks, then disappear. Some symptoms may persist. Exacerbations occur regularly when the oculomotor and abducens nerves are damaged. The clinical picture is complemented by strabismus and asymmetry of the eyelids. A person complains of a split picture. Synchronous movement of both eyes becomes impossible. In rare cases, the trigeminal and facial nerves are affected, which is accompanied by signs of inflammation. Cerebellar lesion. The cerebellum helps us maintain balance and coordination. With this form of the disease, a number of characteristic manifestations occur. Dizziness, balance is impaired. Use of vehicles becomes extremely difficult. The gait changes, the person has a feeling of staggering and falling. Handwriting becomes illegible when looking at the image. It doubles or trembles. When trying to look to the side or up, there is a slight trembling of the eyeballs. Such symptoms are one of the first to signal the onset of the disease. Sensory disorders. When the temporal and parietal lobes of the brain are damaged, sensitivity is impaired, which is expressed in a disorder in the perception of sensations. A person may experience the following for no reason: tingling, itching and burning, feeling of skin tightness and goosebumps, decreased sensitivity. As a rule, sensations are localized only in one specific area, on the face or in the limbs, and quickly recede. In the insignificant severity of the symptoms, and in the fact that they can easily be mistaken for a normal state, lies the whole danger. Over time, the intensity inevitably increases. And even then it is difficult not to attach importance to the symptoms. Sometimes there are disturbances in temperature, pain and vibration sensitivity. It increases or decreases. Pelvic dysfunctions. If pathological foci are localized in the area of certain parts of the spinal cord, urological symptoms appear. Disturbance of urination. The urge becomes more frequent or, on the contrary, becomes less frequent, can be very intense and sudden. There is a feeling that it is impossible to completely empty. Sexual dysfunction in men. Decreased erection. Lack of orgasms in women. Movement disorders. They develop regardless of the stage of multiple sclerosis and are accompanied by an extensive symptom complex. Fine motor skills deteriorate. Basic actions that require concentration become more difficult. Problems with tying shoelaces, etc., paresis and muscle cramps, mainly at night, occur. Reflexes decrease. The symptom is detected only during a specialized examination. Emotional, mental disorders. Non-specific for multiple sclerosis. However, over time, the patient may experience emotional outbursts, anxiety, aggression, depression, and memory problems. Multiple sclerosis is characterized by extensive localization of pathological foci. So symptoms can be quite varied. Basically, a group of certain symptoms appears that appear all at once or alternate. Consequently, the specialist is faced with an important task: to combine everything into an overall picture and conduct a comprehensive diagnosis, allowing an accurate diagnosis to be established. Diagnostics at early stages. The primary goal of the doctor is to carry out a neurological examination, collect anamnesis, and perform a series of tests that will help identify multiple sclerosis in the patient. Diagnostics includes the following methods. 1. MRI scan. Allows you to identify active and inactive lesions in the brain and spinal cord. 2. Visual evoked potential test. Involves stimulation of nerve pathways to assess the electrical activity of the brain. 3. Examination of the spine for abnormalities in the cerebrospinal fluid in order to exclude an infectious factor. 4. Blood test. It is carried out to differentiate multiple sclerosis from other diseases. The final step in reaching a verdict about the presence of multiple sclerosis is to identify demyelination in several parts of the brain, spinal cord, or optic nerves at different times. Treatment for multiple sclerosis involves immunomodulation, correction of the immune system. Exacerbations are treated with hormonal drugs, and in more severe cases, with plasmapheresis aimed at removing antibodies from the blood. Prevention of exacerbations is carried out with drugs that change the course of multiple sclerosis, DMTs. Progressive forms of multiple sclerosis require a complex combination of medications, including the use of cytostatic drugs, slow down or completely stop cell division. For some manifestations of multiple sclerosis, symptomatic therapy aimed at improving quality of life is possible.